The wall of the normal urinary bladder should be evenly thickened. With cystitis, it is common to have a thickened cranial and ventral wall, while the dorsal wall appears normal. This happens because bacteria are heavier than urine. In a standing position, bacteria sediment to the most ventral part of the bladder. The ventral and cranial walls of the bladder receive greater exposure to bacteria. As infection worsens, the bladder wall becomes thicker and rough in appearance. Eventually, the entire bladder wall may become thickened. With chronic cystitis, the patient may or may not show symptoms recognized by the owner. In many cases, symptoms are gradual in onset, and the owner accepts the symptoms as normal behavior. In many cases, cystitis is an unexpected discovery on ultrasound because the owner has not reported symptoms. Urinalysis usually shows dilute urine with a low specific gravity. Blood and white blood cells may or may not be present. Bacteria may not be seen, and culture and sensitivity often shows no growth. The urine sample begins to degrade within 30 minutes of collection. Bacteria only survive for about 6 hours in urine. After 6 hours, a urine culture is likely to show no growth. Bacteria can survive longer in urine if there is a media like blood or debris to sustain the bacteria. If a urine sample cannot be plated for culture within 6 hours of collection, it may be best to centrifuge the sample, discard the supernate, and then swab the sediment with a culturette swab to preserve the bacteria. If ultrasound shows the presence of cystitis, be sure to thoroughly check the kidneys for dilated renal pelvis. The kidneys may be the source of infection. One or both kidneys may be affected. Bacteria can also move retrograde from the bladder to one or both kidneys. With effective antibiotic therapy, the bladder wall can return to normal ultrasonographic appearance within as little as 3 days. Polyps generally result from chronic infections, such as Proteus, or irritants, such as stones. Look for possible causes such as chronic cystitis, bladder stones, or crystals. Polyps can appear as single or multiple small nodules, or large masses attached to a stalk. Over time, polyps can become quite large. On ultrasound, polypoid cystitis is usually identified by wall thickening with multiple narrow-based mucosal polyps projecting into the bladder lumen. Large polyps attached to a stalk may appear as fluctuant masses within the bladder. Polypoid cystitis can look like transitional cell carcinoma, but 90% of the mass is on a stalk, and transitional cell carcinoma is never on a stalk. With effective antibiotic treatment, some smaller polyps caused by cystitis will resolve. If stones or crystals are the cause of inflammation or irritation, they must be physically removed from the bladder. Sometimes surgical removal of the polyp is also necessary. Neoplasia usually appears as a localized, irregularly thickened bladder wall. Tumor cells can extend through the entire bladder wall, even though some areas do not visually appear to be affected. Approximately 90% of bladder tumors are malignant. This video shows a sagittal view of the bladder of a 21-year-old cat suspected to have chronic cystitis. Ultrasound revealed a mass. Transitional cell carcinoma is the most common neoplasia of the bladder. Masses are commonly found at the neck or trigon of the bladder and on the dorsal wall. Tumors at the trigon of the bladder may obstruct one or both ureters, leading to hydronephrosis of the affected kidney. This transverse ultrasound view of the trigon of the bladder in a 13-year-old mixed-breed dog shows transitional cell carcinoma obstructing the left ureter. It is common for a mass of the bladder to extend into the urethra and/or prostate. This video shows a tumor extending into the urethra of a 9-year-old female golden retriever presented for stranguria and hematuria. Many other bladder tumors are possible, including squamous cell carcinoma, leiomyosarcoma, rhabdomyosarcoma, leiomyoma, chemodectoma, fibroma, fibrosarcoma, hemangioma, hemangiosarcoma, lymphoma, and mast cell tumor. Mineralization of the bladder wall or the mass suggests neoplasia. This video shows a transverse view of the urinary bladder in an 11-year-old mixed-breed dog presented for stranguria. Mineralizations of the wall begin in the trigon area and extend into the urethra. Color flow Doppler can be used to show the presence of vasculature within the mass. This helps to prove that the mass is a tumor and not a clot or polyp, as in this 14-year-old cat with chronic hematuria.